Hey everybody, it's Dr. Eric Balcavage from Rejuvigen, and in this episode of Thyroid Thursday, we want to kind of revisit this debate about vitamin D deficiency. I got an email today from another functional medicine doctor whose well-intended post was talking about how deficient we are in vitamin D. He referenced a British Medical Journal paper that discussed how the United States is showing about 69.5% of the population is vitamin D deficient, and in Europe about 84% of the population is deficient. And when there's that many people deficient in vitamin D, I start to have to question the validity of what we're assessing. So the vast majority of vitamin D comes from conversion of something called 7-dehydrocholesterol in your skin. So the sun converts this 7-dehydrocholesterol into vitamin D. We all are in an environment where we get sun exposure. The reality is we don't really need that much sun exposure to get this conversion. So most of us can do this step of converting the 7-dehydrocholesterol to vitamin D. The next piece of the puzzle is that we need that vitamin D to be converted to 25-OHD in the liver. And that step requires something called magnesium. 25-OHD, once it's made in the liver, is the inactive or pre-active form. It actually has to be converted into 125-OHD to actually become active and functional. So, sunlight converts the 7-dehydrocholesterol in our skin to vitamin D. Vitamin D is then converted to 25-OHD via magnesium in your liver. Most of the tests that you're getting done are for this, 25-OHD. And so doctors are saying because this 25-OHD is low in the blood, we have a significant deficiency, and everybody seems to be deficient. Over 70% of the population seems to be deficient. My concern for that is if we're only testing 25-OHD, then we don't know if this step is broken here, or if we're over converting the 25-OHD to the 125-OHD, the active form, which is rarely ever tested, or our body's busy deactivating the 25-OHD to something called 24-25-OHD. If you're only testing the 25-OHD, how do you know if it's a conversion issue from vitamin D to the 25-OHD because of magnesium deficiency, or because of some form of stress, inflammation, or infection, the body's increasing the activation from 25 to 125? Unless you run 25-OHD, 125-OHD, and you assess magnesium, you can't really determine if you have a vitamin D deficiency. We've got people just dumping tens of thousands of IUs of vitamin D into their blood, into their body every day, and yet their 25-OHD is still deficient. So what we have to do is not just assume that everybody's deficient and load everybody with high-dose vitamin D, because it's not working. We need to do a better job of assessing whether a person truly has a deficiency because they're not getting enough sunlight, or if they have a deficiency of 25-OHD because they have a magnesium deficiency or some type of conversion problem somewhere in this process, or if they have some form of stress or inflammation or infection that's increasing the activation or conversion to active 125-OHD, or we have something that's driving the increase in the deactivated form of vitamin D, 24-25-OHD. And this test is typically not available at traditional labs, but this test is. So if you struggle with chronic vitamin D deficiency, before you can continue to consume more supplemental vitamin D, you got to run 3 tests. RBC magnesium, 25-OHD vitamin D, and 125-OHD. You have to run all 3 tests, and you need to have somebody who understands vitamin D physiology assess it. Pounding your body with more supplemental vitamin D is not the problem, or is not the solution. And pounding your body with more supplemental vitamin D may actually contribute to the problem. All right? Hope this Thyroid Thursday edition helps. If you have questions, put the question below wherever you watch these videos. And if you need some help, feel free to contact the office, www.rejuvegencenter.com. Take care.